Hi, my name's Jennie Dwight and I'm a trustee at Community Foster Care. Community Foster Care is a small charity which for more than 20 years has helped young people whose own families have broken down to find secure and loving homes. We have passionate carers at Community Foster Care. They're aware that teaching is one of the most difficult and least rewarding jobs that one can do. We hope that this video might shed a little light on these traumatised young people and their behaviours. As a retired head teacher, I know that every school has their own systems and we're not asking you to go against them. However, we hope that this video might enable you to work together with the carers and the young people themselves in order to make everybody's lives a little better.
My name's Maggie and I've been fostering for 16 years now. They've come to me from backgrounds of neglect. They've come through backgrounds of physical abuse. Sometimes the things that have happened to them. You never expect to see a young child that you're looking after hit the floor and start barking, but I've had a young child that came to me because he'd been so neglected, he decided to live with the dogs, and the dogs were his warmth at night, and he was eating out of bins and dog food. And although he was obviously taken away from that scenario and put with a loving family, I was his respite carer. But when he got frightened, when he got into his survival mode and something really frightened him, he would go back to those days, and his safe place was with dogs. And that, I think, has probably been my biggest shock, to see a child hit the floor and start barking in fear.
Children who come into care have almost always experienced a significant amount of abuse, physical abuse, emotional abuse, sometimes sexual abuse, and neglect. And these experiences and the lack of experiences, neglect, impact the way the brain is structured. The amygdala, which is back here in our brains, is like an alarm system. And if you've experienced a lot of dangerous and frightening things, your alarm system will be very sensitive, a bit like a smoke alarm that goes off when you're cooking toast. And children who are in care, who've experienced developmental trauma, abuse, neglect, will be very tuned in and very focused on looking out for threat. This means that this part of their brain, the prefrontal cortex, which is the part where learning and organisation happens, it's the part that makes sure that you've got your pens and your pencils ready and you know which class to go to. If your amygdala is very busy looking out for threat, this part of the brain isn't available. Children who don't feel safe can't learn.
It can look like a myriad of things. Your young person might be really upset about something, or they may have been triggered by something, and you're watching a reaction and you're guessing that that reaction is about a particular subject, but actually it could be something entirely different, because we associate trauma with, especially post-traumatic stress disorder, with horrendous things that happen at war, with horrendous accidents that happen to adults, but we forget that the young people that come into our care are suffering from PTSD as well. It can have all kinds of impacts on that child.
Young people who have highly sensitive amygdalas because of the experiences that they've had will often be in a state of fight, flight, freeze or flop. And you'll see this in your classroom. You'll see children who walk out, run around the playground, try and escape literally from the school. You'll see children who will shout, swear, threaten you, kick you. And again, you'll see children who literally just sort of freeze, who appear to be completely switched off, won't look at you, can't make eye contact. Sometimes even we hear about children who, when you try to talk to them, actually they're so scared that they wet themselves.
I've experienced that, where a young person in a classroom, somebody comes in late, they slam the door. Kids do. But that foster child is immediately taken back. They're not in that classroom anymore. They're not in that safe place anymore. They're back in their bedroom, where that banging door means that somebody's come to get them. And that fear and that survival mode. And then, of course, they're being told that they're not concentrating. Well, of course they're not concentrating. They're not doing it deliberately. You know, that's really important that comes across.
Hi, my name's Casey. I've been in foster care since I was 4. I'm now leaving care, so it's been a long time. My school was very supportive. There was a support network there for me to use. My trauma first started when I was in year 8. Was a really, really hard year. It was hard to act like nothing had happened at school, as there was certain authorities that had to come in. So the police had to come in, other people had to come in to support me. You know, people would be like, why are you out of class? What's going on? Why are you not in school a lot? I was in and out of school, so it affected my education.
If you're not feeling safe, you can't learn. On top of that, children who are in care may well have missed large chunks of school. They may not have been sent to school when they were living at home, maybe having to stay home to look after a parent who's got mental health problems, for example. And then they may well have moved between quite a few different schools due to changes in where their home is. Lots of our young people have got gaps in their learning because of the moves and the difficulty they've had being able to get on in class. If you already are worried that you're a bad kid and that people don't care about you and aren't on your side, showing the things that you see as shortcomings is really hard. It can be hard for our young people to put their hand up to say that they're struggling, to ask for help, which makes sense given that they've been taught that the people who are supposed to help are often the people who are cruel and dangerous.
The staff there in my learning support were amazing, especially my therapist. I think I had it once a week. She'd sit and I'd just speak to her about anything that was going on. So it was really good, but then there was times when I felt that there wasn't enough support and wasn't understanding that. Quite a few times I'd just leave lesson, I couldn't deal with it, I just wanted to go. And a lot of the times the teachers would have their own opinion of it and, you know, it's not acceptable, why are you doing this?
I had one child who came to me straight from the courts where his parents had been told that they could no longer take care of him. And he'd been told for years and years and years, you know, that social workers and everybody outside the house were bad people and frightening people, and that people wanted to take him away from his parents. So he had a mindset, you know, that everybody was scary, anybody in authority was scary. So going to school for him was really, really difficult. And it took us a long time to understand why he was behaving the way he behaved. And people thought maybe that because he was putting his hoodie on that it was just rebellion. It wasn't. That was his safe place. You know, when he first came to me, he was frightened, he was confused, he didn't know what was going to happen to him, he didn't know why his parents had been taken away. So his safe place, to keep him in survival mode, if you like, was to put a hoodie on, to put his earphones in, because if he didn't hear it or see it and nobody saw him, maybe those bad things wouldn't happen anymore. So when he was trying to do that at school, of course he was breaking all the rules and he was being, in his mind, punished for it. So what we did in the end, we came to a compromise where a trusted teacher or a teaching assistant would understand what was going on, would quietly take him away from the main classroom into a private area where he could put his earphones in, where he could put his hoodie on and feel safe and know that he was being listened to. That happened lots and lots in that particular school. And in the end, the young person began to realise that he was being looked after, he was safe, and gradually, the need for the hoodie became less.
My therapist was amazing with me. I really trusted her. I was able to talk to her, and if I had any problems, she was the one that would sort out. Whereas when you're sat in a classroom trying to explain to the teacher why, when there's students around you, it can be quite embarrassing, I think, for some people. It can be very overwhelming, so sometimes you just have to leave that situation, otherwise it gets worse. A lot of people that went to my school that were in care, I've seen what they're like and how they deal with it, which is completely different to how I deal with it. Might be acting up in class and doing things that they shouldn't be doing, but then that is their way of coping. But I think some teachers look at you as you're the naughty student. It's the understanding of why is the student acting like that. You haven't actually talked to the student properly about it, because we all learn differently, we all deal with things with differently.
schools are really caring and they really want to help, but they've got restrictions around the number of other young children they've got in the class, and we can't stop anybody else's education. So because of the restrictions they've got, it can be very hard for them to deal with young people who are highly traumatised, because again, they're seeing behaviour that can't really be tolerated in the classroom, but then they also, like us, know that that young person is coming from a different place, and you can't just punish that behaviour. We need to find ways of dealing with it. So schools are very open and they want to learn, and teachers want to learn, but it's how we can get that information across about what that young person's triggers are, and how we've dealt with it at home, and how possibly we can help schools to deal with it in a way that helps everybody.
I think there should be some sort of provider who comes in and talks to not just the teachers but also the students, because it's not talked about enough. It's not the behaviour of the student, of how they might be feeling. It's just not spoken about enough. So maybe bringing like a training provider in to speak to the school and, okay, what do you do if that happens? Okay, because when I went through my trauma at school, I don't think half of them knew who to even contact in the first place, because it was such a big thing that they didn't know how to deal with it.
The training we get here at CFC is so good and so informative. That would be wonderful if that training could be taken into schools so that teachers could really understand the things that we've been taught about how trauma affects you, how our young people are a lot of the time in survival mode, which is a really exhausting place to be, and why they often fall asleep in the middle of the day. It's not that they're getting good quality sleep at home. So I think if there's any small things that we can do, like letting teachers know what the triggers are for that young person, and without getting too personal about it, letting them know a little bit about their backgrounds and why they're acting the way they are, and mechanisms for dealing with it at school, it's just going to be helpful to them.
So what can you do to help? Well, the biggest thing is to try to build a relationship with the young person, to help them to realise that you're not going to belittle them, that you're on their side, that you get why being at school can be really hard for them. They will probably benefit from having stuff written down, either on the whiteboard so they can see what they're supposed to do, or a visual reminder next to them on their table. They may well need longer to process things, so when they're on the spot and asked a question, that might be really hard for them. They may well benefit from sitting at the back of the class where they can see who's doing what and who's coming in and out, and this will help their amygdala, their fire alarm system, to settle down a bit, because they know what's happening. There won't be any surprises for them. Try to avoid situations where they might feel like they're being put on the spot, and give them a way out. So, for example, give them the opportunity to go and talk to a different member of staff about what's causing a problem, or to go to a safe place where they can see a member of staff that they do have a trusting relationship with.
But luckily, again, I had the learning support there. They understood what was going on. They understood why I was doing it. So a lot of the time I wouldn't be in class. I'd be in like a separate room. So I was able to get away from the situation.
Make sure that your young people who are in care know who they can go to for support.
I think for the teenagers, they need to know that they're being listened to, that they're being valued. And although they wouldn't maybe admit it, they do like the guidelines, the boundaries, and the fact that they know you're going to be there, irrespective of what horrors they might have done. They begin to respect that, and they begin to know that they are safe and that they are being listened to. And I think if you can provide that, you're onto a good thing. And so are they.